suffering from weak and tight pelvic floor muscles, when you laugh and sneeze and cough, you have a leak with low back pain at the same time with difficulty opening it up if you have pain during intimacy. So this will cover a lot of areas. Even though you don't have pain during intimacy, this is great for you. If you have diastasis recti, this is safe for you. Let's strengthen our core if you're perimenopausal, menopausal women, or if you are postpartum. If you are cleared by your doctor, make sure you have a clearance. And if you are at least 6 to 8 weeks postpartum before you proceed to any exercises. And if you find this too difficult, my recommendation is to hold off. I have a lot more beginner program you can start. You have to learn how to do proper breath work, how to do the different techniques. And today we're going to learn the knack technique. So knack is a technique to help you not to pee when you cough. So my friend here, Sandy, will join us. And we're going to start the breathing and how to open up that rib cage laterally and how the pelvic floor goes down. So you're going to place your hand on your abdomen and one on the chest. And if you start rising on your chest, that's not good. You want to make sure you rise through the lateral rib cage. You can place one hand on the side or on your abdomen. So as you breathe in through your nose, what happens, you're expanding your diaphragm all the way down, descending. And guess what happened to your pelvic floor, Sandy? It starts stretching gently downward. And then as you breathe out, you lift and contract. Imagine Kegels now. Kegels is when you squeeze a blueberry inside of you from your vagina going to up to your kidneys. As you slowly breathe out through your mouth, like blowing through a straw. And what happens to your pelvic floor? It starts lifting. So as you breathe in, without lifting your shoulders up to your neck, you want to keep your shoulders down. As you breathe in, exhale, zip it up. Imagine not to pee. You can be in cross-legged position, seated in a chair, standing up or lying on your back. Sitting helps a little bit feedback, and you can place this soft foam roller. If you need a soft foam roller, come with foam right now, or get the link down in the description below. And when you sit, place this on your bottom, which is the perineum, which is the basin of your pelvic floor, like this. So this is 3 inches, and then you can cross your leg. There you go. She has the purple foam roller. It matches her beautiful outfit. And now we're gonna hold our breath again. Place your hand here. As you breathe in, and if you can't do cross-legged, you can extend your leg or slightly bend your knees like this. So when you slightly bend your knees, you're gonna feel your perineum more inside. Can you feel the pressure? It's hard. It's hard for the balance. So it's a lot on the core sitting on the foam roller. And because this is 3 inches is lower, you can get the 6 inches. The 6 inches is actually elevated, so it's easier. So this is a little bit less diameter for sitting or cross-legged. You can use roll towel, you can use pillows. So again, you take a deep breath. So if you're postpartum, even 2 weeks postpartum, this is a great way to begin. And exhale, zip it up and breathe out. Imagine the blueberry squeezing and slowly blowing through the straw, a tiny straw. You can grab a straw, place it in your mouth. And if you have a weak breath, a shorter straw is better. And then you can slowly add the longer the straw to breathe out. Again, inhale. Exhale, breathe out and zip it up. It's like you're zipping up a tight jean going up. And you don't want the zipper to touch your skin. And breathe out. Again, inhale. Exhale, zip it up. Well done. So sitting on the foam roller, can you feel the pressure there? It gives you that reminder. So now we're going to lie on your back, placing the foam roller underneath your pelvis. So this is a beautiful foam roller that I meticulously designed. It took me a year to finally finalize. And it's a pre-sale, so you will receive this around April 2025. It's a little bit delayed, but you're going to receive it very soon. Okay, my friends, with your knees bent and then the foam roller underneath your pelvis, you take a deep breath through your nose, expand your abdominal muscles. As you exhale, zip it up. And this is now gravity assisted. Now your pelvic floor is being lifted easier, so your organs are not pressing it down. It helps lift it. Can you feel it's easier, right? And you can place your hands on this bony prominence here between your pubis and the lateral ASIS, so in between this muscle belly, in the lower area of your lower abs. So you take a deep breath, expand. So you can see my abdominal muscles rising, and then exhale, zip it up like a tight jean. And you can do a little bit pelvic curl in. Can you feel that you're squeezing your buttocks now? That will give you that extra boost of lift. Can you feel it? And then inhale, you relax your back, relax your abdominal muscles as you breathe in. Exhale, zip it up. Again, inhale, expand. Exhale, zip it up. Now we can combine with movement. So tabletop is one of my best movement as you breathe in. Exhale, zip it up and tabletop. You're gonna feel that stretch on your hip joint. Can you feel that, Sandy? With your toes pointing away. And then inhale down, slow and steady, don't plop. Expand. As you exhale, exert, breathe out, and lift. Inhale down. Exhale, zip it up. I'm so excited to invite each one of you of my upcoming April challenge. So mark in your calendar, April 8th, I'm inviting each one of you to join this beautiful challenge. Breathe out. And we're gonna be in a community of like-minded men and women with pelvic floor issues and finally fix this pelvic floor pain. Diastasis recti, if you have a gap, or if you have latchkey bladder. And this is a beautiful program, challenge that in 8 weeks, you're going to fix it together. So join me, and Sandy will be there as well in this beautiful community. And you can reach out to me if you need my support, personalized to your needs. Again, inhale. So far, so good, Sandy. Feels good, right? Exhale, zip it up. Well done. Now we are proceeding by tabletop with the kick. So inhale. Exhale, zip it up and kick. Lengthen, toes pointing to the heavens to lock your knee. Can you feel the stretch, Sandy? Inhale, bend, back to tabletop, and then exhale down, slow and steady. And then we switch to the other side. Inhale, exhale, exert as you slowly lengthen and lock your knee. See, it's easier for your right knee. So it means your left knee has more weakness and tightness. Breathe in, breathe out. Breathe in, exhale, lift. So click the link on the description below and join the April 8th challenge. I'm going to open the cart and registration for those who needed my support and guidance to finally fix their pelvic floor issues. I'm so excited to meet my new students. Last set, inhale, exhale, lift, and stretch. Inhale, down, last set. Now hold that position with your toes pointing to the heavens and we'll do a small circle like a size of a small dish. Try to keep your pelvic stable. Try not to rock your pelvis, keeping it attached tightly on the foam roller. 10 times clockwise. As you breathe in and breathe out with your right toes pointing to the heavens. And then exhale, switch the other way. Reverse circles as you breathe in and breathe out. Don't forget your breath work. And now from this position, hold on to the foam roller if you need to, Sandy. As you breathe in, breathe out slowly, lower to the side. Open that hip adductor. So this is the mirror of your pelvic floor. If you can't lower to the side, you're tight. And if you feel the muscle, inhale, and it's really soft, then that's what it feels inside. Then it feels wiggly. So you want to make sure the tone is like the feel of your thinner eminence of your thumb. So if you palpate your leg, Sandy, can you feel tightness? So that's your pelvic floor. That's the mirror. To palpate and touch it, you feel a little bit hard, right? So that's what you feel inside. So it's hard to open. So we need to open this. If you're postpartum and you felt like during your intimacy you have pain or tightness, then it's time to open it slowly with the breath work. So we're together with the movement and lifting that pelvic floor to be functional. Not just lifting, but you also bear it down a little bit to gentle stretch. As you breathe in, expand abdominal muscles, you're bearing it down a little bit, but as you exhale and open and lift, it gives that beautiful stretch. Okay, now let's switch to the other side. Well done. Do you feel that beautiful stretch? Now extend the other leg. This is her tighter area. You can see Sandy is having a hard time unlocking her knee. And it's okay. If you're slightly bent, that's fine. Someday, this is your goal, Sandy, okay? And then we'll do small circle like a size of a small dish. As you breathe in, breathe out, zip it up. Don't forget to exhale to zip. Inhale, exhale. Now we'll do reverse circles. Breathe in, breathe out. Well done. Now from this position, you take a deep breath, hold on to the foam roller. As you exhale, slowly lower to the side, feel that hip opening. And you can feel your hip adductors. I want you to touch your hip adductors, guys, so you can feel the difference. Is it tighter on your left side, Sandy? So it means inside of you, on your pelvic floor, you're tighter on your left. So we have asymmetry, it's normal. But when there's a big difference on your left and right, then that's not normal, right? You want to make sure there's a little bit tightness, but not to the point you can't even lock your knee, right, Sandy? So that's my goal for you someday. So we'll keep monitoring Sandy's progress every time we see each other in the mat. That's why the April 8 challenge will be coming soon. I'm so excited to meet each one of you if you need help and guidance. It's actually recorded videos as well that you can follow along for 8 weeks. If you can't make it on time, don't worry. But the reminders from me is we're going to be a continuous progress for the next 8 weeks. So we're going to reach our goals. Like, we're going to hold your hand to reach your goals to finally fix your pelvic floor issues. Last set. Well done. Can you feel that stretch? It's getting more tired on your left, right? Now with both legs up to the heavens, toes pointing to the heavens, like a ballerina. As you breathe in, breathe out. We're going to do double leg circles. This will help zip it up, tighten your lower abs, tighten your core if you have diastasis recti. You can place your hand on your abdomen, making sure there's no doming. Doming is when you see a bulging coming out on your abdomen. So you want to make sure there's nothing coming out like extra effort, especially when you lift your head up and there's a bulge. So make sure your head and shoulders are really flat on the mat. Now let's do reverse circles as you breathe in and breathe out. And then let's reverse circles. Again. Now we're going to do a beautiful V stretch. So now we're going to combine the left and right. Hold on to the foam roller as you breathe in. Breathe out. Open your knees out to V, like a letter V. And you can place your hands on your hip adductors and feel the tension. As I said, this is the mirror of your pelvic floor. And you can do a little bit massage. You can massage it a little bit, Sandy, if you like, and feel it. Like squeeze it, both hands like this, to release the tension. Can you feel it? Yeah, it's so tight, right? And then dorsiflex, which means toes pointing you, as you breathe in and then breathe out back center. And once you reach the center, toes pointing to the heavens again, inhale, exhale, open, and release this hip adductors, dorsiflex. As you breathe in, breathe out. Inhale, exhale, open. Inhale, exhale, back center. 2 more. Last set. And that's it. I'm hoping you learned a lot. This is only the beginning. My free video series that you're going to learn a lot about my April 8 challenge. So if you want to learn more on my next challenge, don't miss out. Mark on your calendar. I'll be sending emails on how to join. Click the link on the description below. Write your name and email address so you can be reminded to be a first come first serve basis for the April 8 challenge. And I'm so excited to meet each one of you inside my Revive Pelvic Floor Health Core Rehab to finally fix your latchkey bladder, weak pelvic floor, diastasis recti for good. And I'm going to have a lot of resources for you to learn on what and how to begin, and not to be nervous on how to begin this program, because sometimes it's overwhelming which one to begin. That's why it's a step-by-step guide. You're going to get the entire blueprint of my Revive Pelvic Floor Health Core Rehab, and you can finally get my free 7-part video series if you want to start right now for free. Check out all the link on the description below. You're going to go through every 2 days free new videos on how to welcome those pelvic floor muscles, to revive them, to wake them up, if they've been sleeping for a while. And that's why when you laugh, sneeze, and cough, you have a leak or you have a gap in your abdomen, you haven't closed it. It's not too late to close the gap and you don't need surgery. And I've fixed thousands of men and women with diastasis recti and pelvic floor issue. So I'm hoping to see you in my next video training. Thank you, Sandy, for allowing me to treat you today. It's been a pleasure working with her, and she's learning a lot so far, right? On how to be more flexible and strong on her pelvic floor. And she has 4 babies. 4 babies, she went through a lot. Isn't she looking amazing? And I can't wait to see you inside my program. If you have more time today, watch episode 1 over here and episode 2 just over here on how to do the proper breath work. Until next time, always remember, be safe, be well, and healthy you. Bye!